Yes.
Good morning, everyone. I would like to present to you the results of a study we did, where we compared the bacterial culture results between a deep nasopharyngeal swab and a non-endoscopic bronchoalveolar lavage in preweaned calves. So first of all, we all know that the pressure on the intensive antimicrobial consumption in food animals is increasing, and that therefore the reduction of antimicrobials and a rational antimicrobial use is a top priority. Secondly, bovine respiratory disease is the leading cause of antimicrobial use in calves, and in several countries, as also in Belgium and the Netherlands, for a BRD outbreak, you can choose to work with first-choice products like penicillin, trimsulfa, and fluorphenicol. Or if you want to use certain classes of antimicrobials like third-line cephalosporins or fluoroquinolones, you have to sample, do a bacterial culture, and a susceptibility test are requested. But still, there's a lot of doubt on how a BRD outbreak should be sampled, because you have a large group of animals and diagnostic techniques cost money, so you want good interpretable results and also the best return on investment. So if you look at the BRD outbreak, how you can sample it, you have three different kind of methods. So you have a deep nasopharyngeal swab, a bronchoalveolar lavage, and a transtracheal aspiration. These three methods differ in sampling site. So if you look at the respiratory system of a cow or a calf, you can see that the deep nasopharyngeal swab goes through the nasal cavity and samples the nasopharyngeal tissue. Transtracheal aspiration penetrates the trachea to avoid nasal contamination and flushes the bifurcation of the lung. And a bronchoalveolar lavage also goes through the nasal cavity into the trachea and can sample every lung part. There are also some other differences between the three methods. So you can see that a swab is the most easiest one to perform. It's also the cheapest one. For the representative of the deep airways, the flushing methods are the better ones. But with the ball, you can have possible contamination by passage through the nose. Also, for sample quality, there's not really sure what's the difference in sample quality between the three methods. If you go a little bit further to the ball procedure, you can see that you have two different methods. So you have an endoscope-guided and a non-endoscope-guided ball. Each has its advantages and disadvantages. So with the endoscope-guided ball, you know the exact location where you're flushing. You can prevent nasal contamination by using a sleeve. But the disadvantage is that it's an expensive material. You're working with animals, so you have risk of damage of the endoscope. And you also have contamination when you're sampling different animals. A non-endoscope guided ball or a blinded ball is a good way because you don't have contamination between the different kind of animals you're sampling, but you can have a possible nasal contamination. Also, there's no information on the exact location that you're flushing. But here on the conference, I have a poster where you can see that if you use a non-endoscope guided ball and you do a sedation, because for animal welfare it's sometimes done with the ball, that you can see if you sedate the animals, you always get in the dorsal part of the lung, and if you don't sedate the animals, every lung part has the same chance of being sampled. So if you look at these two methods, the most practical one is a non-endoscopic guided ball. So we compare that with the deep nasopharyngeal swab. And therefore, the objectives of my study were to determine the sample quality, the isolation rates, and the agreement between the two methods, both in healthy as diseased calves, and also to determine if a polymicrobial swab result has an influence on the nature of a ball result. Because if you look at the pathogenesis of the disease, you know that opportunistic pathogens can grow in the nose by predisposing factors and that they descend into the lungs. And it's generally assumed that if you pass the nasal cavity, that you have contamination of your ball results by this nasal flora. So we also wanted to investigate that. So we did a cross-sectional study where we had 144 calves with BRD and 39 healthy calves. We paid a lot of attention on these healthy calves because in previous studies there were apparently healthy calves that were from the same herd as the cases. But we deliberately took healthy calves from different herds because when they're in the same herd it can happen that they already have been challenged and already have inflammation. So to avoid the subclinical BRD, we had healthy calves from different herds and also had a normal clinical investigation, no abnormalities on thoracic ultrasound, and also didn't have a BRD outbreak in the last month. So we took a swab and a ball from each calf, and we did bacterial culture on a Columbia blood agar for the Pastoraliceae, and for Mycoplasma species we used a PPLO agar. And if you then look at the interpretation of the culture results, so for the sample quality we used 4 different kind of categories. So you have the negative culture, which means that there were no target bacteria on the plate and less than 2 colonies of contaminants. Polymicrobial culture means that there were multiple bacterial species on the plate and you couldn't identify one. A pure culture was 1 target bacteria on the plate, and a dominant culture was also a target bacteria on the plate, but with 1 or 2 contaminants, but you can still identify the target bacteria. So that was for the sample quality. For isolation rates, we used phenotypical characterization and also biochemical tests. If we then go to the results of the sample quality, so in this table you can see the cases and the controls and also the 4 different kind of categories we have. And here you can see that the results for the cases are the same as for the controls. So a ball has significantly less polymicrobial results. So for a swab that was 69% of the cases and a ball only 21%. It also has significantly more negative results for a swab that was 15% and for a ball that was only 40%. There was 40%. And for a pure culture, a swab gave 8% pure culture and a ball 29%. So if you look at the interpretable results, so that means every category except for the polymicrobial results, you can see that for a ball that was 79% and for a swab only 31%. If we then go further to the isolation rates, you could see that isolation rates were much higher in cases than controls, but this can already be explained by the apparently healthy calves I was talking about. If you go a little bit further for the isolation rate, so per bacterial species, you can see that there wasn't a difference in isolation rates between a swab and a ball, except for 1 species, and that was Histophilus somni. So for a swab that was 1.4%, for a ball that was 6.3%. But this can be explained because Histophilus is rapidly overgrown by contaminants. So because swabs have more polymicrobial culture results than a ball, it's logically that you have more isolation rates from a ball than from a swab. Agreement was done by means of kappa statistic, and here you can see that for all the bacterial species there was a moderate agreement between the 2 methods, but for Histophilus there was a slight agreement. So that was 0.16. Then the effect of a polymicrobial swab on the culture of a ball. So here on this table you can see if you have a polymicrobial swab result, and here the isolation rates of a ball and also the negative culture results of a ball. And here at this table you could see that if you have a polymicrobial swab result, it doesn't influence the negative culture of a ball. So the contamination by nasal passage is less excessive as previously assumed. But if you look at the bacterial species, you can see that for Mannheimia and Pastorella, the isolation rates were decreased when you have a polymicrobial culture of a swab. But here, non-selective media were used. And if we look at the Mycoplasma species, you could see that there wasn't an influence of a polymicrobial swab result, but here selective media were used. We also saw for the polymicrobial culture results that there was an important herd or sampler effect, because we had sampled different herds and also used different samplers. So that hygiene measurements and also technical skills of the sampler are important things to look at if you have the isolation rates. So in conclusion, a non-endoscopic ball gives better interpretable results than a swab, so it's 79% instead of 31% for a swab. Isolation rates are higher in diseased animals, so it's better to sample sick calves. there wasn't a difference in isolation rates between a swab and a ball except for Histophilus somni, so in this case it's better to use a ball. And the polymicrobial nature of a swab result doesn't influence a negative ball result, so nasal contamination is less excessive as previously assumed, but it does have an influence on the isolation rates of the Pasteuracea, but not for Mycoplasma species. So hygiene measurements and also technical skills are important things. So in conclusion, at this time, a non-endoscopic ball gives higher return on investment because you have to sample a large group of animals and you get more interpretable results and with the inclusion of Histophilus somni. I would like to thank everybody who helped me with this study and thank you for your attention.
Thank you very much. Ahora, if there are some questions, we have a couple of minutes. Yeah.
Very nice presentation, Sebastian Budzianski, University of Montreal. What was your definition of a BRD case, of a case? You talk about the excluding subclinical cases, but what was the definition of a BRD case?
So we used a 4-point scale in the clinical investigation where we had cough, nasal discharge, temperature, and also depression, where we had a score from 0 to 3, and if there was a score of more than 5, then there was a BRD case, and we also used ultrasound for a look at consolidation. So that were the criteria.
I think some other question. Yes, there. Yeah, please, a microphone.
I want to, did you look at the antimicrobial susceptibility and compare the difference between the species that you isolate from the deep nasopharyngeal swab and the one you isolate from the bronchoalveolar lavage?
We didn't do this in this study, so we just looked at the sample quality, but we're now investigating that too, but this wasn't a part of this study.
Okay, thank you very much then for the excellent presentation again.